Good morning. The meeting of the Board of Health will come to an order today, October 11th at 9:03 a.m. And we will start with a roll call.
Jamie Steig,
Present.
Avish Nagpal,
Present online.
John Strand,
Present.
Kayla Nelson,
Present.
Lynn Telford,
Present.
Neemal Day, Bernie Dardis, Grant Severson,
Present.
and Jim Capitan.
I'm here.
Okay, thank you. Let's also do intros since we have Commissioner Strand asked for some introductions so that we make sure we know everyone who's at the table with us. So we want to start with you, Mayor Mahoney.
Mayor Mahoney.
Good morning. I'm Mike Rethinger, City Administrator, City of Fargo.
Nancy Morris, City Attorney. Good morning. Brenda Derrig, Assistant City Administrator.
Jan Eliason, Director of Harm Reduction, Fargo Gas Public Health.
Jen Fell, Director of Fargo Gas Public Health. Holly Scott, Public Information Officer with Fargo Gas Public Health. I've been with the organization for 23 years.
Good morning. I'm Dr. Larry Annenson. I am the Director of Health Protection and Promotion at Fargo Gas Public Health, and I've been with the organization for just over 16 years.
Good morning. I'm Suzanne Schaefer. I'm the Director of Nursing at Fargo Gas Public Health, and it'll be 10 years in January that I've been here.
Hello, I'm Melissa Perla, and I've been the accountant at the Public Health Department for 30 years.
Doug Murphy, Emergency Preparedness and Response. I've been with Fargo Gas Public Health in this role for almost 17 years.
Morning, Grant Larson, Director of Environmental Health. I've been with Fargo Gas Public Health for 29 years.
Kim Vance, I'm Director of the Fargo WIC program. I've been with WIC in the Public Health Division for 23 years.
My name is Jamie Stagg. I'm a pharmacist and board member.
Grant Severson, I'm a pediatric rheumatologist and board member.
Lynn Telford, I'm a registered nurse and a board member.
Kayla Nelson, I'm a nurse practitioner and I'm a board member.
Jim Capitan, Cache County Commissioner.
And I'm John Strand. I'm the City Commission liaison to the Board of Health, and this is my second appointment to the board. I was on it for 4 years, had 4 years off, and I'm really glad to be back and to get to work with all of you.
Okay. Next item on the agenda is approving today's agenda. So I would entertain a motion to approve it.
So moved.
A second?
Second.
All opposed, say aye.
Aye.
Aye. Any opposed, same sign? Agenda, motion carries, agenda is passed. Next item on the agenda is approval of the minutes from September 20th. The Secretary's draft of the minutes has been provided to us, so please, if you've identified any corrections, let us know.
I'll move to approve.
I'll entertain a second.
I'll second.
All in favor, say aye.
Aye.
Any opposed, same sign. Motion carries and the minutes from September are approved. The next item on the agenda is operational budget reduction. And since we do not typically hold special meetings for this board, I would like to kindly remind the board of the open meeting laws related to special meetings. While regular meeting agendas may be added to or altered at the time of the meeting, for special meetings, only the specific topics included in the notice may be discussed. Any questions on that? Okay. And then similar to what I did the last time in September, I just know we have new people today listening. So as we go through this agenda, I want to just remind this group and the community the board's role in public health And these can be found on the City of Fargo's website. They're in our bylaws. I'm not going to read all of them, but ones that we believe relate to the topics at hand. Excuse me. Be a community advocate for public health. Make recommendations to the Board of City Commissioners and Cass County Commission regarding public health issues and ensuring policy and legislation is based on the most rigorous and current scientific evidence, based on expert recommendation or evidence-based or promising practices. Provide feedback on the Public Health Department's strategic plan and provide guidance on goals and objectives and ensure alignment with the Health Department's mission. Assist in providing feedback and identifying and prioritizing programs using data highlighting community needs. Reviewing the annual budget and fiscal reports and providing a recommendation to support or revise. And review and make recommendations regarding the Public Health Department's policies and procedures involving significant changes. So as we get into this next topic, I would like to start the discussion by asking for an update from the leadership team on recent changes to the health officer role. But before that discussion begins, I would like to provide context as to why that topic is related to this agenda item. On September 19th, the day before our last board meeting, Kayla and I had a chance to talk with Jen as she explained the 4.2 budget FTE cuts that came as part of the budget reduction. During that conversation, she explained other operational budget cuts, such as the Family Nurse Partnership Program, and then referenced other cuts. And I know that Kayla and I both asked if we could get any more information about those and how we understood it. We got into the conversation about Dr. Newman's contract. And so as we understood it, that was part of the operational budget cuts. And so that is why that particular topic is related to operational budget cuts. And so I've had 2 conversations about the health officer position. I think you've been involved with one, but I don't know that the board has been aware of any changes that are coming or have been discussed with the health officer. So if we could get an update on that.
Certainly. I did have a conversation with the health officer about the current contract that is held. The current contract is for 20 hours of on-call to Fargo Cass Public Health. It is a contract that began in August of 2023. It was doubled in 2023. Previous to that, it was 10 hours a week, and it had been at 10 hours a week since 2018 when Dr. Baird retired. When Dr. Baird was there, it was 30 hours a week with consensus from the management team and with the director at that time. The health officer position was changed to 10 hours. Through COVID, Dr. Lako stood up the COVID response with a 10-hour contract and stayed at 10 hours until she ultimately passed away in 2021, at which time Dr. Newman took the position of the health officer. In 2023, the contract was changed and is now with partnership with NDSU. The current health officer's name is not in the contract. It is for NDSU to provide us a faculty to act as a health officer at Fargo Cass Public Health, that we are to pay for 1 or more positions at NDSU. And at any point the faculty person leaves NDSU, they are not obligated to serve Fargo Cass Public Health with a health officer. The current contract doesn't have the full coverage of Fargo Cass Public Health entitled to it. So, for example, the harm reduction program is not covered in the current contract. I had a conversation with the health officer to terminate the contract ultimately with NDSU and to reduce the hours of the health officer program. The conversation was a surprise, obviously. The conversation is not new with the management team or with leadership. It has been discussed within budget meetings and with the management team to assure that we were making sure the needs of Fargo Cass Public Health and the departments were being met. Those hours were not felt as need from all the different departments, and when the budget was being reviewed, they wanted to give back some of the dollars from their programs because they weren't being utilized. That caught my attention in the budget review and made the annual review of the contract that came due in August of 2024 for us to review that contract more carefully. And we've done that. I was still in consideration of that in our conversation on September 19th. With further review, and just last week, I had that conversation with Dr. Newman. It was not done without lots of intention.
I'll open it up to any board members that have questions.
What was the last thing you said? It's an echo. I can't really hear you.
It's really hard to hear.
Sorry, that the conversation I had with her was not done without a lot of intention, with a lot of thought and reflection with a lot of the managers and leadership.
Can you be specific about who that was? Can you be specific about who you discussed this with?
Everyone at this table has had part of that conversation.
Did you think it would be helpful to talk to the Board of Health about reducing the public health officer's role?
I did ask Kayla and Lynn about this on September 19th, asking what the hours may be helpful, what would be necessary, and they weren't able to guide me as to what those hours ought to be for a size of local public health unit like Fargo. We are different than and larger than the others in the state. What I have done for the homework of that is to compare us to other Midwest local public health units of like size, and the hours vary greatly. They have paid practitioners that serve as the health officer. They have people, and I can give you, if you want to see what those comparisons are, I can share that with you for 6 of the other largest Midwest. Lori, can you bring up that slide, please?
And just for some background, I think we asked the question about how a county or district our size should be resourced and what the salary should be. We asked that question. And I think on the 19th, we both had the impression that, you know, you had mentioned you weren't sure who this could be discussed with because of the contract. So we ensured that we would not share the information. So I believe we were the ones who asked, because we would like to see that information before to support a decision, right? Because if we see that like counties or like cities, there's a big disparity, that would make sense. And I also think that 10 hours, that's the minimum required in the North Dakota Century Code, I think.
I don't believe there is a minimum requirement.
Okay.
Other local public health units do not have a minimum hours. Okay. And to have that conversation with the Board of Health in a public format such as this was without regard to having that conversation with Tracy first, or to have a sidebar conversation with your chair and co-chair is what I attempted to do, and was not able to seek that advice or guidance at that time. The discussion of continuing on with whatever the hours may need to be, my response, and when I talked with Lynn just last week, Friday, was that there was no data to support one way or the other what those hours ought to be. There has been no data collected over the past year's time to justify the continuance of a 20-hour contract. There was no change in scope of the contract. There was no change to the strategic plan to make it advanced or more robust. There was no new outcome expected with a 20-hour contract. So when I tried to do that, it was trying to have this conversation in a non-public format.
So did you ever consider asking Dr. Newman if she would want to have reduced hours?
That was the attempt of the conversation when we were having that on Tuesday last week.
Was that what happened in the conversation?
That is not what happened in the conversation.
Okay. Did you ever ask her about reducing her hours?
Prior to Tuesday, no. Tuesday of last week, we talked about not having this contract and the need to reduce the hours. The challenge was that she didn't want it to be without the NDSU contract. She didn't want to have it be an independent contract as it was previously. We talked about going back to 10 hours or less because the managers that had years of experience at Fargo-Cass Public Health were not fully utilizing 10 hours a week. And so when we talked about going back to even less than 10, she just was frustrated with that and had said, well, if you wish to go back to an independent contract and have less than 10 hours, then that's the city's wish and direction of which they want to go. I wish you luck, was the comment.
So just to clarify, was she, were you in communication with her about wanting her to continue her duties and reduce her hours? Or was it the conversation of this contract is being terminated and we hope you reapply? What was that conversation?
The latter, that we would, yes, be terminating the contract. Notice has not been given of termination, just so you are aware of that at this point. This was a conversation that we had begun to have, that we would do an RFQ with some of the job duties explained that we need to have for Fargo-Cass Public Health, and then figuring out what those hours ought to be and talking further through it, having an RFQ and encouraging her to reapply for such a position again.
And why would she have to reapply?
It would be a new contract, a new opportunity, and lesser hours.
Were there any other physicians that were contacted during these conversations to see if they were interested in serving as the health officer?
I had talked to somebody to see if they were interested in providing services to our family practice clinic, yes. This was an area in which Dr. Newman had expressed to our NPs that she did not have and stated it was not her strong suit. And so they have been consulting with other people and outside of our practice and doing curbside consults.
So the conversations were related to seeing patients in family practice, not becoming the health officer.
Providing consultation services, not seeing patients. Providing coverage to Fargo Cass Public Health.
As the health officer or not?
Potentially.
And when did that conversation take place?
Prior to September 19th, when we were looking at the need for change within the health officer function and hours.
When exactly did that take place?
I don't remember the date of that.
Okay.
And it was to verify if there was interest in said positions in the community.
If I could make a comment, it's kind of an unusual contract. So what people don't understand is when we came out of COVID, we weren't sure how many hours we needed the health officer. Dr. Newman did a great job during COVID, and we were trying to transition. Normally, we would have hired outside with a contract, just a pure contract without NDSU. We were trying to accommodate her wishes. She felt it was better to have this NDSU contract. Jen discovered that if we disrupt that contract, we have to tell NDSU, and then we, as a city, we'd have to do an RFP. Here's what our needs are for a health officer. We'd hope Dr. Newman would continue to be that role. She can apply, but it'd be an independent contract. When the administrative team looked at it, we were saying, what are we doing with the 20 hours, or do we need the 20 hours? I apologize, it's part of my question to ask as mayor, and John Strand, we would go through that. Do we need the amount of money we're spending for the public health, or can we cut that back a bit? It was a question to the management team that Jen works with, and I said, try to identify how many hours we need a public health officer. I think you all know during COVID, it was 20 to 40 hours a week. It was horrible. I mean, it was a lot of time that was done at that time. So all we're trying to do is say, what do we need? What services do we need? We identified family health care also needs some help. So there's some question, is there anybody that can do this? And I think you as a team know it's really hard to find doctors that will help in the public health arena. Just it's hard to find people. So there could be conversations, but we have to go through RFPs because of the city of Fargo. That would open up to anybody who wants to apply, and they'd have to be qualified to do those positions. So what we have asked the team to do is identify mission of the city, mission of the public health, mission of your group, and let's satisfy that mission of what has to be done for our community. And that would be the idea. So I know there's a lot of concern and consternation about this, but the reality is, and Mr. Strand is part of this as well, we as a city have to figure out how much services we do and how much we want to pay for it. And that's part of what drives what we're going through. Jen was tasked with that and worked with her team to come up with that. So this isn't an isolated, she came up with this on the fly. Brenda had been working with her on it as well. So the questions you're asking is just, we can look for a reduction, but we would have to terminate our NDSU contract because that's for part-time, 20 hours a week. If we're not needing 20 hours a week, we have to do that. It's cleaner if we just do a pure contract. I mean, it's kind of awkward when we have this thing with NDSU. It should be really, and I think Dr. Newman now is a full professor out there. So to me, in my mind, that she should do okay as far as compensation for her position. And if we do a pure contract, then you pay either hourly rate or you pay how many hours people come and help out. I work at Family Health Care. I get an hourly rate. When I'm there, they pay me, and if I'm not there, they don't pay me. So that works fairly well for me. And I would assume you as a board would kind of like something that, pay for the hours we would use the person. So just giving you insight.
Yep, and I do understand that, but is there anything with Dr. Newman's position that she was not fulfilling? Is there any part of her role that she wasn't capable of the reduced hours?
She does things that we've asked her to do. It's just a question, do we need 20 hours? Do you absolutely need 20 hours or not? So if she's doing the job or doing what she's supposed to do, pay her for the hours that she does that. I'm not aware that she spends 20 hours a week at the family or at the public health service.
Right, but what I'm wondering is if the hours were reduced, was she not fulfilling like her role as a health officer? And that's why you would need to hire or open up for reapplication? I'm just curious, it just feels to me as if when you're telling someone their contract is going to be terminated, and then there would be a potential for you to reapply, that sends a very different message. That sends a message of, we are looking for someone else.
No, in city government, what that is we're following the rules of city government. We have to do an RFP. I may want to hire her, but I still have to do an RFP in fairness to any other physician in the public domain, or maybe somebody else who wants to apply for it and has a skill set that would work with us as well. Not meant to insult in any way, but the NDSU contract was kind of a special carve-out we had to work out with. It's not something we normally would have done, but we still would have to do an RFP because that's what you have to do as a government entity. Correct me if I'm wrong, Mike? Yeah.
So I know one question, and this is probably more appropriate for the commission, but since we have Mayor Mahoney and Commissioner Strand here, at the last commission meeting, as the budget was being discussed, we referenced trimming the fat from the city's budget. And the two departments that were impacted were the DE&I and then Fargo-Cass Public Health. So, and I'm speaking on behalf of the letters that I've received from stakeholders throughout the state, from other board members, from community members. What does the fat look like in the budget? The 2.2 FTE cleanup that was an accounting cleanup, that made sense, right? Positions that have been sitting there for 2 years that we've decided we don't need. What could that have looked like across the city so that we wouldn't have to put all of that trimming on a new director within the first month for public health?
Well, I can have Michael answer this, but we actually cut $3.5 million in all the other departments. So we cut a lot of places. We hired 0 people. I've never hired 0 people for the city of Fargo. I have 1,500 employees. This is the first time in record I've ever not hired anybody. I don't know how many of the requests we had, Mike, how many $1 million worth of requests for that, but we did not, that did not go forward. We had vacancies in the health department, which worked, and we had an area that we felt that we could do a reduction. And DEI, we felt that some of the things that we needed and wanted to come out of there were not happening, and felt that could be reduced at that time. There was no pick on the health department. You have how many employees?
177 employees.
So we have 177 employees. We feel they're fulfilling their mission. And the question to Jen was, are you going to change anything on the strategic plan, or does this compromise the strategic plan in any way? And it does not. So we have no intention of taking that away. I think you as a team are going to relook at your strategic plan, and let's see if there's anything else we need to change. I don't know if we need to change the makeup of people or what we do. I think we're looking at employee health as well. But every department, Susan Thompson isn't here, but on the budget team, every department's being looked at. Brenda has scrubbed the personnel and seen that. What you didn't see is a reduction in force in other departments, but there's no additional employees, and we haven't filled some positions, and where there are vacancies, oftentimes we're not filling right now. So that's not what hits the public. That's not what you see.
And in fairness, I did email all of the commissioners on September probably 15th, got a short response from you, got a short response for you, but nobody actually answered the questions like you just did. So that's helpful context. So I don't know if there are any other questions related to the cuts that we want to get into that anyone had.
I guess one of my questions is, in the cuts, it seems like, was it 3 MPH positions? Or
2 people held it. Dr. Newman has her MPH.
So I just want to know, that seems like really important people And out of curiosity, I'm curious, with the health department, how many people have an advanced degree? And what was that looked at?
We prepared that slide for you. That was new information that was requested earlier this week. We did a survey in-house because that's not information that's captured readily. We will present something to you now that has a response, basically, of what those are. We still have 4 MPHs, at least the ones that had responded to the survey in this short period of time. There are our staff credentials. I'm not going to read them, but for the public, if that's something that they can see. The collective years of experience at Fargo-Cass Public Health is 1,199. We have advanced degrees in-house. We are not bleeding talent.
No, absolutely. I think I would call that about a 40% reduction in people with an advanced degree in public health as I look at those numbers just real quickly.
I think you identify an area that's really hard to get nurse practitioners at times. I'm a concern when I saw it at first, their vacancies hadn't been filled for a while. But recognizing in healthcare, it's really hard to get nurse practitioners to fill those slots. So the question that Jen was asked is, they hadn't filled, many of them hadn't filled for a year. And was it something that was mission critical or something or a strategic plan? And only when I was satisfied it was not harming that, because I know, you get somebody and then if we lose them, it's just hard to find another person to fill that slot. So my question, because I was very concerned on losing nurse practitioners with this reduction, is are we going to lose any part of our mission? So Jen, if you'd please address that.
The other part of that is MPHs are not a requirement on the positions within. One of the strategic plans is to have a diversified workforce at Fargo-Cass Public Health. From the degrees that you can see on the board, we have a very diversified and pretty deep bench of experience at Fargo-Cass Public Health. With the strength in years of our management team, we are not floundering. I am the new person at the table, absolutely. And when we are asking the questions and what the commission has asked us to do, and I understand you as an advisory board to us, please understand that we are not victims of this budget. We have made commitments and decisions that we are all comfortable with, and that we can continually work to support the community population and our staff and fulfill our strategic plan.
And just, Lynn would understand this, that if I have 5 vacancies, I still have to budget for them. I still have to put money away from. So if I reduce that, I don't have to put money away. And the hard part for Mike is if I have 5 police officers, we didn't bring any police officers on this year, but if I put 5 in the budget, that's almost $750,000 I have to find to fund that. So he has to have it in the budget. So when I get the reductions of vacancies that weren't filled anyway, at least I don't have to have that money put away. So that's where it's very helpful to us in the sense that it's called salary savings, but the reality is that you have to have it found in the budget. So that's when we didn't fill 0 positions and we don't have, quote, any vacancies that we have that we're not filling, then I don't have to find money for it.
So was this decision part of the budget that was reviewed September 20th?
Yes. September 20th with you, no. September 30th with the budget approval process, yes.
So on September, and I think the board is just looking for transparency about, we knew about the 4.2 FTE. I knew under confidence that the contract of the health officer was being looked at, but holding that confidence, the fellow board members did not know that. And so I guess, what did we not talk about or ask on September 20th that would have helped us understand that information, that the health officer contract was going to be part of the reduction in budget?
That was a conversation I wasn't ready and our team was not ready to have publicly.
Okay.
It would not have been discussed on September 20th publicly.
And then, go ahead. No.
Is there a manner in which we can have conversations that are not on a public forum, that we can actually have a work space to have such matters where you can advise me, where our public is not watching, where the names of the places and the positions that we have to consider and to hold respect for those positions and to not have that publicly aired
No, I
without
completely
quorum.
agree. Yeah, I agree. And I think that was the challenge and why we're having this special meeting, because as I started getting contacted by the community staff at Fargo-Cass Public Health board members, I talked to Michael and Nancy about this yesterday. We don't have any method right now to have conversations with a larger group of the board that doesn't involve quorum. So at this point, this was really the only way that we could have the discussion. And I was asked to not wait until December by my peers. So I do appreciate, I don't think I said that earlier when I started, but I do appreciate the time that everyone took to come today.
Did you ask anybody else in the Department of Public Health to take a pay cut or reduce their hours?
I'm sorry, there was an echo. Can you say it again?
Did you ask anybody else in the Department of Public Health to reduce their hours or take a pay cut?
I have not asked for hour reductions. The other positions that are utilized in their hours are working, and I'm not saying they're not working, but they're full. Those hours are needed. We have had a reduction in our nurse program, a position that has been vacated, and they are doing a review of shifting that work and seeing if that actually works. And if it does, then that position potentially in the future will be rolled back to the general fund as well. It is a sample period of time right now, but that makes everybody else in that department pick up extra work. In the health promotions program, there was a resignation. That work has shifted. Everybody else now has picked up extra work. So when I'm looking through all of the different departments, we had a nurse practitioner who chose to go down to 0.8. Right, so those extra, any other areas that people are not fully busy or working anytime there's been a reduction, that work has been shifted to other people to pick up and do.
So which of the 20 hours that you keep referencing that she's not doing, was she not utilizing to be a public health officer? You mentioned that 20 hours is too much. So what of those 20 hours is too much? What isn't she doing that you feel she should be doing with her role?
She's doing everything that she needs to do in her role. It just doesn't take 20 hours to do it.
So how long should it take? You said 10 hours. So what is she doing? What do you guys think she's doing for those extra 10 hours that you guys are paying her?
I do not know.
Okay. Did you discuss that with her?
There's no accounting to that.
Did you discuss that with her? Did you ask her to account for that?
I asked her. I did not ask her for an accounting of what she's doing. She had done that previously, and that is the recommendation that I had moved back to when I discussed her doing the 10 hours and submitting the invoice for that. That was not desirable. That is what the history was from the accounting team.
Which
and
was
I want to go back to this.
30 hours a week previously, and then it became 10 hours for how many years?
6.
Okay.
5 years, from 2018 to 2023. Okay. I would like to go back to this being about the health officer position.
Okay.
And taking the person out of the position and making sure that it is the health officer position and the needs of Fargo-Cass Public Health.
Can you identify what you feel the most important needs of that position are?
We need somebody to oversee some of the lab services that the previous health officers have done. We need to have somebody be a consultant to our nurse practitioners and be able to provide support to them when they are asking for. That's in-house that we're providing support to. We need to have that support to our harm reduction team and the people that come to the engagement center. We have homeless health there currently that does some of the visits, but previously we've had consultation to our withdrawal management unit, the Gladys Ray Shelter. That has not been added to this contract. We need to have somebody who is going to be, and does a fine job already with immunizations. I mean, the current health officer is exemplary at all of those things, right? With the immunizations and working with the nursing program. The standing orders, and when I think about what, WIC, I'm not sure what the needs would be, but there are some things, and this is just the short list off the top of my head of the things that are needed to be fulfilled more. This is not something that she has failed to do. This is something that we need to have more of.
And so you're asking you to have someone with fewer hours to fulfill all the things you think that aren't being fulfilled already?
I'm asking somebody to fulfill those requests from contracts that had previously filled those things within the 10-hour scope that was offered previous to the 2023 contract.
So Jen, didn't Dr. Baird also act as coroner?
He did.
If I remember right, so that was another hat that health officer wore as well back when. Is our current health officer the coroner now? Okay.
I think, was he .75 health officer, .25 coroner or something? I don't remember. And it's 10 years later, probably, so. I think that when we look at the reduction of the workforce reduction as related to the operational budget cuts, the other thing is just Fargo Cass being a leader in the state. And so when I receive communication from other public health entities with these specific concerns, I don't know how else I'm supposed to take that, right? So I have received 3 letters thus far from public health leaders in the state that I will share with the commission, share with the Department of Health. 2 of them I received yesterday, 1 of them I received this morning. And I think, right, and so I think that that will speak beyond what I can do. It's beyond my scope to speak for them, but it's my responsibility to share those communications. And I think that will help support the reason that we're here today, that these concerns are not just the concerns of the 3 people that have spoken today, but that it's a broad concern.
I just also want to point out with Jen, with our conversation that we had the day before the board meeting on the 19th, it was explained to Lynn and I that Dr. Newman was the highest paid health officer in the nation. And that that was one of the biggest reasons for this when things were looked at with this. And that there actually were statements from you that she was not fulfilling some of her duties. And so that's where I was concerned. And the way you presented those to Lynn and I made me wonder, you kind of, the way you explained it to us, you made it seem like it was a backhanded deal between people to have her in this position. And the way you presented it made me feel very concerned. Why would this be happening? And so I wanted more information as to the validity of her being the highest paid health officer in the nation. And I never received that, so we had to kind of do our own research on that. And it just feels unfair when you are explaining to Lynn and I on a conversation about things she's not fulfilling, and that she wasn't willing to help when she was asked to help in certain areas. And I just feel like it felt a little personal in the conversation you had with Lynn and I. And while I understand that changes are necessary, they're important, they can be really hard. I think it's also very important that we do so in a kind way and be able to provide facts that are accurate to us when we're asking questions, because we are not employees of the city. So when you're making these decisions, I think it's really important that we know exactly why these decisions are being made, because we ultimately care about public health and our community. And so upon further investigation, it does not appear in terms of her hourly rate that she is the highest paid health officer in the nation. And when we look at other things to compare her salary, I just am not finding that data. And the other piece of, like, when we look at budget cuts, right? And whether it be, you don't need 20 hours, that's fine. But we look at, some of the salaries for our other staff, like emergency preparedness. The salary for that here in Fargo is, $108,000, and compared to Grand Forks at $52,000. That's double. Okay, for health environment, $123,000 versus $40,000 for Grand Forks. Those feel like big differences in ways that salaries could potentially be looked at. health promotion and maintenance, 127 here versus 69 in Grand Forks. I know that we're bigger than Grand Forks, but those are big differences. So as someone who's very passionate about our community, about public health, about what I do for work, I just feel like some of the decisions that have been made feel a little targeted. And just, I'm curious, were those looked at, right?
No, I've not looked at reducing any of the other positions, directors that have had the 20-plus years in their services. When I look at environmental health and the 11, that we have the biggest per capita eateries here, 1,100, that their team goes out to review, that we serve the 6 other counties as well. Other local public health units don't support 6 other counties. Our emergency preparedness does the same, and it is the regional emergency preparedness. And so it is a regional environmental health person as well, supporting 6 other counties.
Also just curious then, from those regions, if we could, those regions that we're supporting with these salaries, if we could, as a board, get feedback on what they're doing to help those other communities.
Certainly. There's the 6 other regions that come to Fargo-Cass on a monthly basis. Environmental health, Alton and Grant, if you want to address what you do for all of the 6 other counties in outreach, if I'll let the experts in the field speak to that.
Yeah, environmental health in the counties is extensive role is on-site septic systems with the counties. We have contracts with them. So they do evaluations of existing on-site septic systems or permit new ones. They would go into those counties and complete that work, as well as nuisances. We also do pools, aquatic program in those counties as well, and then consulting for public health hazards. So we do all those services within the 6 counties in southeast North Dakota.
Are those services reimbursed to Fargo-Cass Public Health?
There is a regional grant that does cover some of those services.
But there's grant monies. You know, I think, Kayla, you're touching on a topic. I'm new, again. We need to have all of our stakeholders pay their share. And we need to make that a priority with the broader regional community. You know, who's funding what and how much, and, you know, and that's my general sense. That's a really good topic for a board to aim at, you know, is a reimbursement and equity and providing services that are, you know, but anyway, that's just, I appreciate that. Thank you.
I think that's a good point, Commissioner Strand, because we can look at cutting budget, but also where can we bring in money? I know you guys do a great job of looking for grants, but where can we, as the largest district, or largest department in the state, provide more consultative services that could be reimbursable?
We just added $245,000 in revenue in the last 2 months to our budget lines for 2025.
From grants, right?
No. Okay. From billable reimbursable services.
Okay. I know we're coming up on time. The next agenda item is Public Health Strategic Plan, and I understand that it's in the process of being developed.
No, the strategic plan was developed in 2022.
Okay.
Do we have a copy of that? Have you read the strategic plan for Cass?
In 2022, we probably did. So if the board could be sent the strategic plan, that would be helpful. I would assume it's going to be, how often do they get redone?
It hadn't been done for 10 years prior to 2022. The current strategic plan is good until 2025.
Okay.
The concern had been the impacts of the budgetary reductions on the current strategic plan. With the management team's discussion about the strategic plan, which I actually just read yesterday in preparation for this meeting, to discuss where we're at in the strategic plan, and we are not going to be falling behind any further than it already had been with the current reductions. Again, it hadn't been made any more robust with the addition of hours, and it will not change. The strategic plan will not change with a new director. It has been casted by the needs of the Fargo-Cass Public Health, not by my vision that I bring. we will be part of, and we will have a much larger stakeholder base in the next casting of this strategic plan. You had asked for, in one of the previous and proposed backgrounds and needs for Fargo-Cass Public Health, is to be able to establish a framework to share ongoing high-level agency priorities and strategies to engage community stakeholders and to have that be more public. In the past week, we've talked about having a Clear Impact Suite, which is a website that has public-facing data. We have a lot of data in-house that we would be able to share. I've gotten feedback from nursing, WIC, and harm reduction to be able to share those numbers on a monthly basis, live time. And so that is one of the ways that we can engage with the data sharing, performance reporting, and program planning, and be visible to our stakeholders. There are 5 strategic areas within the strategic plan for Fargo-Cass Public Health. One is communication, with goals that were to be achieved in December that had not been achieved at December 2023. Using and updating external processes for enhanced communication through media channels and key stakeholders. I think we've had plenty of media on Fargo-Cass Public Health in the past while. But we'll continue to use additional media channels and key stakeholders through the rest of this year. Collaboration was another strategic area. Number 2, our workforce. One of the goals was to provide needed resources for our workforce by December 2023. That is vague, and we'll ask for some clarification from my management. To engage and support staff in working together toward a shared vision. When I arrived, the 3 departments put an effort in towards a grant. We hadn't heard back on that grant that we should have heard at the end of September. It's sitting in pending status. We haven't gotten our score on that. That was collaborative efforts within our programs. Enhancing and recruiting and retaining our workforce was a December 2024 goal. Our policy. Since being in office, we've worked on supporting the Government Services Committee on a Housing First priority and a housing initiative that was in the Governmental Services Committee that has passed and is now moving forward as a bill. And we'll continue to work towards legislative issues that support Fargo-Cass and the Fargo community. Health Department infrastructure, developing and implementing processes to monitor and support implementation of organizational performance improvement plans was by December 2023. That was not met. Assure comprehensive, up-to-date agency policies are in place by December 2024. We'll have some management team meetings to address those and have those current for December 2024 for public view. That's our strategic plan.
One question that's related to the operational budget reduction. We had talked about this at the September 20th meeting. We no longer have a public health dietitian on staff, and my recollection is that the dietitians at WIC would be able to cover that. Can they cover public health services under WIC contract?
I'm going to let Kim address that because her department, and I believe they have 9 registered dietitians. All of the staff at WIC had a change code where all of them needed to be registered dietitians. And there's 1 certified breastfeeding lactation, that's not the right name, lactation specialist.
And their contracts are to provide WIC services. So if there was a need on the public health side outside of WIC, how would we be able to utilize those registered dietitians?
What we were tasked with was taking over the MCH funding. There's an MCH grant that's funded to provide breastfeeding support to the community. So we were able to take on those tasks, and our IBCLC will be the one providing those services to the community.
Who will be, I'm sorry?
Our IBCLC, we have someone that's a lactation consultant. So she will be the person that will be taking over that grant.
And then what other public health services might benefit from dietary expert or nutritionists besides breastfeeding?
Well, I'll defer to Larry for.
Yeah, the areas that were the responsibility of the person who resigned are extremely important to our community, and there's no secret about that. So we were very strategic in we cannot drop these initiatives, we cannot drop these programs, so how are we going to meet the needs of our community? With the dietitians in WIC, we were able to cover some of the breastfeeding support We do have a community health educator that's been with the City of Fargo for over 20 years that is involved with some of the food system, Hunger Coalition, Cascade Food Partners, and so on. That was the responsibility of someone else. So before the last day that the individual left, we made sure that those areas are covered because they are extremely important. And as Kim mentioned, some of their work is covered by a current MCH grant through the state of North Dakota.
I'm just trying to understand how the WIC contracted employees can provide non-WIC services.
The WIC grant does not cover the cost of WIC entirely. So general fund is picking up that difference.
WIC is not 100% federally funded?
No, it is not.
Okay. Thank you. That is helpful. Okay. Any other questions from the board on the public health strategic plan? I know it'll be probably a topic at our December meeting as well.
Yeah, my only comment is that strategic plans should be continually reassessed and evaluated, and so that would be an important thing to share on a regular schedule at board meetings.
Anyone else?
Madam Chair, we have a new public health director, and we have a public health board, and I want to commend you for caring as much as you do to convene, to have this conversation because you care that much, you know, and yet our shared reality is to, and I think the vision for public health is very clear, and the passion is palpable. Our position is we have a new director that's going to come in and doing the work that this director's been asked to do. And my sense is this is an ongoing, you're kind of being evaluated. But baptism by fire, but you know, we have to trust you too. You know, we have to have faith that your decisions are for the right reasons. But we also have to empower the board and trust the board too, and have this transparency between us. So this is a healthy moment for us to get to know each other. I've been apprised of our new director's anticipated changes, and trust me, we've also worked these topics through. In the initial foray, I didn't support the RIFs because in my mind, it didn't go far enough.
Mm-hmm.
You know, in the end, I voted for the budget, though, knowing that it's where it landed. But, you know, a year from now, when we look at your position, we'll all have the moment, the time and the luxury of looking back, go, how did it all work? And it is a work in progress. So I commend everybody here. I really do. I think it's great to have people publicly serving. And it's great to have capable people, and you have 170 some in your department, and public health is something we can be proud of. But so I hope this is a good moment for us to kind of get bonded, to know each other, and to get a sense of each other. The board's an advisory board. You know, you don't have authority to interview the candidates and hire the candidates and fire the candidates and all that, but we need the input from the board. And I'm guessing you've gotten a sense that you have a really impassioned board, you know, and you also have a sense that we have a really capable new director. So I just want to thank everybody, you know, and it's not always easy making changes and being a change maker. I fully expect that if anybody sees anything that compromises public health services delivery, you'll be in the hot seat, as should be the case if we start compromising and pulling back and eroding public services.
I don't think will be is the right tense.
And that's my
A
confidence.
little hot
in
right
you.
now.
Mhm.
And 3 of the people sitting across from me were on my interview candidacy.
Yep. But as we have trust, right? I'm not saying that you don't have complete capacity to do this job. I was part of that interview process, and I was blown away by your resume. But there have been some things in a very short period of time that had made me question that trust. And so I agree 100% with you. We all care about this community and we care about public health, and we are an advisory board. But some of these decisions that have been being made will directly impact public health in our community. So, and the other piece and part of strategic planning before we end, I do want to know previously discussed the function of the board at our last meeting and reviewing the bylaws, which were updated in 2022. As part of strategic planning update, I am questioning what changes are, and this could be answered at the December meeting, but what questions are planning to be made on this, and I'm curious if you're planning to change the composition of the board.
Can you clarify that for me, Kayla?
There's just been some discussion about the potential of changing the composition of the Board of Health.
Who's had those conversations?
Their feedback from the community, phone calls that I've received from staff that I'm holding in confidence. And so I think that, again, that can be a discussion for December, and the four of us can sit down and have those conversations also.
Okay, yeah, that's news to me, Kayla. I've not been aware of those conversations. So if you choose to add that to the December meeting, we will have that conversation. In regards to the strategic plan, it looks as though the goals expire December of 2024, and I can give you an update at that time. In our first meeting together, I asked for collaboration with this board as part of key stakeholders in the development of an ongoing and enhanced strategic plan, as well as other community stakeholders, because the previous strategic plan was done in-house. That was addressed in our last and first meeting. And at that time, it seemed as though it was an agreement that was made. I don't know if that will continue.
There had been some changes in this board, haven't there, when Commissioner Preston was here, I believe?
In 2022.
And my sense was that it was a focused, increased focus on medical providers with that skill set at the board, I think.
Yeah, so we just want to make sure there's not conversations to go away from that, because there was a lot of intent put into that, making sure that we had a board that was engaged in the community and that have, medical science or healthcare background. And I think the biggest thing is just transparency. And I feel like a lot of the conversations we've had up until this point have been reactive versus proactive. And, I've tried to set up time with you in the first 90 days. And it was, I'm sure, what do they say? Drinking by the fire hose.
Right. Yeah.
For you. So, I reached out to Lori to set up the first agenda planning meeting, and we haven't had that opportunity. And I think that's what I opened the last meeting with by saying, we are here to advocate for public health and to the board and to the staff. And so I want to make sure that transparently, had we known more information, I think questions could have been asked, in different ways. But we're relying on the only people communicating with us are stakeholders other than this group. So maybe that's something that we can work harder on going forward.
I would hope as the board that when you field a concern that you would feel open enough to call me or my supervisors or anybody on my team to get input without it needing to be a public forum meeting, and that you would have the confidence to be able to answer some of those questions more immediately. I can respond to those letters that I received yesterday if you wish. I can provide reassurance to our 6 counties that we support that they will not go without the services that we are currently providing.
Okay. Any other questions or comments from board members?
I'll say one more thing. I can't stop myself. We have a lot to be proud of after what we went through in 2020. I was very, very proud of Cass County and Fargo-Cass Public Health and our position relative to the region and to the state. And part of what you're sensing, I'm guessing here, is Dr. Newman, as the health officer, was very critically important in a pivotal role in that public health response. And we did it strong and proud, and we done good. You watched out for the people You know, and we can't forget that accomplishment. We had other neighbors and other people in the state that didn't respond like Cass did. And I think the data speaks for itself. We had a better result. We had fewer deaths than we would have had otherwise. So kudos to this board and to public health for what you all went through this last few years and the growing that we came out of it with. And so I'm guessing that's just a sense of we've gotten through that. There was some real leadership, and you're redefining positions right now. It's not about the person, it's about the position. But hats off. I was so proud of our backbone for doing what's right.
I
Just
agree.
saying.
I do think relationships within the state are very, very important. And so when we do lose people through attrition, through retirement, through budget cuts, we do also lose the relationships that those people have built, which is the influence that they've been able to make for Fargo-Cass Public Health. We're looked at as a leader. We'll continue to be looked at as a leader. But, you know, when we talk about the position versus the people, I think it's still important to remember that the people did, you know, they represented us well. They had strong relationships within the state. And so that is worth that consideration in that conversation. It is 10:04. Is there, yep. The next order of business would be public comment. So is there anyone today for a public comment? Was there anyone, Lori? If you could speak your name and then your comment.
My name is Erin. So as a citizen, a taxpayer, mother, nurse, a member of the community here in Fargo, living very closely to the downtown region, working very closely with the public, you know, the cut in hours from the position seem to be the opposite of what the direction of what our community needs. With the growing population and then the need or request to have them cover things like, you know, the harm reduction, et cetera, our community is struggling greatly with, you know, addiction and having resources and stuff for those members. And so I'm concerned that taking this on and reducing hours and as well as adding on other things that have been mentioned is going to greatly impact it's going to overstretch the role and then reduce quality for our community. And that is very concerning as a member of this community.
Thank you for your comment. Yes.
Good morning, board. Is it this one? Can you hear me?
It's that, yep.
Okay, a little short over here. I'm coming a little bit as a dual hat right now. So I am the administrator for Richland County Health Department, which is just Wahpeton south of us. And then I'm also a resident of Fargo. So kind of a dual vested interest in that I call Fargo my home, but I also am one of the partners that receives support from Fargo-Cass. And we were disheartened. I'll speak a little bit on behalf of the other administrators who weren't able to be here today to hear about the position cuts. Partially, as was mentioned, we do receive a lot of support from Fargo-Cass, and we want to make sure that we maintain that support. We are all smaller departments. I'm the largest one of the rest of the group with 13 to 14 full-time staff, and so for us to meet all of the needs, looking at like environmental health and emergency preparedness, we just don't have that capacity, and so we do heavily rely on your team to do that work for us. And we do have concerns, like I said, with the positions being cut. I know a couple of the positions that were cut, we also relied on heavily just for support for information and things that they would share. And so we're concerned that there'll be a gap in services that way. That wasn't through any formal contract or anything like that, but that is just being public health across the state. We all kind of fill that need, and we all share resources that aren't necessarily tied to a contract, but information and help as we can. The other concern I have is we all know Fargo is growing like crazy. And that's no lie. I've grown up in Fargo and been here almost my entire life. And I feel like the last thing we need to be doing is cutting public health services as the community is growing. If anything, we need to be adding employees to public health to help better serve the community. Because as the community is growing, we also see a great need for public health. And I think the need has increased as well, especially when we look at I don't want to say coming out of COVID, because COVID is definitely still here. And yes, it was a crazy time during COVID, but we still see a lot of health disparities and individuals facing various social determinants of health that need our services. And I think when we cut positions, we're doing an injustice to our community and an injustice to the individuals that live here.
Thank you for your comments.
Thank you.
Anyone else?
I do have one request not related to this meeting. If we can figure out the mic situation in future meetings, it's very difficult for me to hear, and I don't know if it's just me, but.
It's very difficult.
And so it's hard for me to follow conversations. It's hard for me to really know what people are saying. And so if we could figure that out, that'd be great.
Agreed.
Is it different when you're at the dais? Better at the dais? Okay.
I think maybe because we're farther away, like we can hear you talking, but then we hear the echo, where when we were up there, we didn't have the echo.
I like the idea of this, but it's, if I can't hear you, it doesn't, then that loses the benefits of this format.
So we'll work on some tech fixes for that for next meeting. There being no further business to come before the board, the meeting is adjourned at 10:10 a.m. And again, I thank everyone for their time today.